My name is Diane Bonet and I consent to this video.
Hello.
Hi.
Hi, my name is Rebekah. I'm going to be your nurse today. How are you doing?
Good, how are you?
Good. Can you just confirm to me real quick your name and date of birth?
Diamond Bonet, 12797.
Perfect. Let me just look at your chart here. Great. All right. I'm just going to provide some privacy by closing your curtain. And I have some hand sanitizer in my hand. I'm going to go ahead and wash my hands. So do you know where you are today?
Valencia College.
Can you tell me what year it is?
2024.
And why did you come in today?
For a head to toe assessment.
Okay, perfect. And do you have any allergies?
No.
All right, so I have all my supplies here that I'm going to be using. I verified who you were, your date of birth, and if you had any allergies. And I can see that you're able to speak, you're talking to me, so I see that your airway is intact. And do you have any pain right now?
No pain.
Okay, your level of consciousness is ANO times 4. I'm going to go ahead and bring your bed up to working height. Just for the safety of my back. And I'll go ahead and take your vitals.
Wow.
All right, let me grab some gloves. Is there any concerns you have today?
None.
Perfect. Have you been around anybody with COVID or
No, I haven't. I feel good.
Okay, I got 102/78. Does that sound correct?
Yes.
Let me go ahead and check your pulse and your oxygen. Okay, .1. I got 17 for respirations. I have 99% oxygen and then a 66 pulse. I'm just going to go ahead and check your radial pulses here. They're both bilaterally strong. Your brachial pulses, bilaterally strong and equal as well. Okay. Okay, and you said you had no pain, correct?
No pain.
All right, so now I'm just going to begin with a sensory perception. I'm just going to inspect, visualize, and verbalize your head, eyes, nose, ears, and such things, okay? So I'm just going to look at your scalp. Have you had any history or issues with your scalp?
No.
Okay, it's free of lesions, dryness, masses, I don't feel anything. You don't have a headache or anything right now, do you?
No.
Okay, and then your skull size and shape was symmetrical. There was no abnormalities there. Looking at your face right now, it looks symmetrical to me. I don't see any edema or any masses or lesions. And then your eyes, your position and alignment, it looks correct. They open spontaneously. They're not bulging out at me, so that's good. And your eyebrows are symmetrical. The hair amount looks equal bilaterally. And it doesn't look like there's any abnormalities there. And can you move your eyebrows up and down for me? Give me excited, frowny, angry. Give me a big smile. Puff your cheeks out for me. Great. And then can you do a big smile with your teeth? Can you stick your tongue out and go ah? Move it side to side. Perfect. Okay. And your eyelids, your lashes, the coverage of it looks equal. There's no ptosis. I'm just gonna look at your conjunctiva and sclera. Just look at the color. You don't mind that I touch you? Is that okay?
Yeah, that's fine.
Okay. So conjunctiva looks nice and clear and pink. Your sclera is clear and white as well. I was looking at your irises. There's no abnormalities in your pupils either. Just looking at it. And then your cornea, it was transparent, shiny, smooth, looked good. The iris shape and coloration was equal. I'm gonna go ahead and check your perla now. If you'll just look straight ahead. Okay. And then I'm just gonna check your visual fields. If you'll just follow my pen, your 6 cardinal fields. Perfect. And then if you can just keep looking at my pen. All right, perfect. So it looks like your size and shape and equality of your pupils were all equal, bilateral, and reactive to light, and accommodation was there as well. Looking at your ears, they look symmetrical. They don't look like they have any lesions, lumps, bruising, masses, or anything like that. And you can hear me correctly. Is that right?
Yes.
So I'm going to perform a whisper test. If you can just cover one ear for me, I'm going to whisper something in your ear. I want you to repeat it back, okay?
Okay.
If you'll just cover one ear.
Pears.
Good. That was correct.
Pineapples.
That was also correct. All right. So it looks like your external auditory was good. Your auricle size was symmetrical, position was good. Color, lesions, there was free of cysts. Are you able to move your ears? No?
No.
Okay. Does this bother you when I move them for you?
No.
Pain free? Okay, good. And your nose also looks symmetrical. It looks from the outside free of lesions, and there's no discharge coming out or bleeding or anything. Do you have a history of nosebleeds?
No.
Okay. And looking inside, it looks like there's no lesions or masses either. And are you able to breathe through both nostrils?
Yeah.
If you can just test for me, just hold one, take a deep breath in. Good. And then hold the other. No problems?
No problems.
Good. All right. And so now I'm just going to look at the inside of your mouth just to see your oral mucosa. Make sure that the color, your teeth, tongue, everything looks good, okay? Mm-hmm. So if you just say ah. If you just say ah one more time. Okay. And can I see your teeth? Good. So it looks like your oral mucosa color was pink, free of lesions. Your teeth were in good condition. Your tongue was pink. It didn't look swollen or anything to me. The surface looked smooth. Looks like pink and moist all around. Your tonsils didn't look swollen. Neither did your uvula. So your mouth, your oral hygiene is present. I'm gonna go ahead and palpate your sinuses now, and just let me know if you have any pain. Okay. So right now I'm gonna check your posterior auricular. It's behind your ears. And it's free of any masses. I don't see any lesions either. And it's pain-free. Your occipital behind your eyes. So usually palpate around here, behind the head and neck. Okay, free of masses, anything. And then your submandibular under your jaw, free of masses. And then your clavicular, free of any masses as well. And I'm gonna check your thyroid. I'm just gonna palpate it first, and then I'm gonna tell you to swallow. Okay? Okay. Go ahead and swallow. Perfect. Okay. So all of your lymph nodes that I checked were free of any masses, at least that I could feel, and you were able to swallow perfectly fine. So I'm gonna check your cranial nerve 2. Oh, well, I would check your cranial nerve 2 to test your vision acuity, but I would have to use a Snellen chart, and we don't have that here. But you don't have any problem with your vision, do you?
No.
Okay, perfect. And then I'm gonna check your cranial nerves 3, 4, and 6. And that's when I did the 6 cardinal fields and the gaze of any nystagmus. Everything was present, no nystagmus noted. Okay. For the cranial nerve 8, I did the hearing test, and you performed well. You were able to state back to me both words in each ear with one ear covered, so you passed that. And you passed also the cranial nerve 7, which was the facial. And I didn't notice any facial asymmetry or any involuntary movements. You were able to smile, frown, lift your eyebrows, show your teeth, and puff your cheeks. And it was free from any abnormalities. I'm going to go ahead and check your cranial nerve 1, which is your olfactory nerve. So, do you have any difficulty breathing?
No.
Okay. Can you close your eyes? Can you smell this?
It's like alcohol.
Okay, good. So your cranial nerve 1 olfactory is intact, and you didn't have any difficulty breathing either. And you were able to say ah for me. So that was your cranial nerve 9. And then cranial nerve 10, I would be checking your gag reflex. I'm not really going to do that, but I would essentially just use a tongue depressor and try to gag you and see if it worked. So that would be cranial nerve 10. And then for cranial nerve 12, I'm going to ask you to stick out your tongue and move it side to side. Good, perfect. Okay, so cranial nerve 12 is intact. Cranial nerve 5, I'm going to ask you to identify soft and sharp objects for me. I'm just going to touch your face and then see, you tell me if it was soft or sharp, okay? Close your eyes. Good.
Sharp.
Good.
Soft.
Good.
Sharp.
Good. All right, so cranial nerve 5 was intact. And I'm going to evaluate your motor function. I'm going to ask you to clench your jaw. I'm going to press down on your chin. I want you to resist me, okay?
Okay.
I want you to resist me. Clench your jaw. Good. Okay. So cranial nerve 5 was intact. And I would also test your corneal reflex, but I don't have anything soft to put by your eye. So I'm just going to verbalize that I checked it and it was intact. So cranial nerve 11, I'm going to ask you to shrug your shoulders and move your head from side to side, okay? Perfect. So cranial nerve 11 is intact. Just looking at your skin from up and down, like at your bony prominences, it doesn't look like you have any bruises, bumps, lesions, or any abnormalities in your skin. Your lower extremities, your feet, let me see your feet. Good, good. Your feet look free of edema. Your arms look free of edema. Your hair quality and texture, distribution, color, all of that looks normal. You don't have any excessive hair loss, do you?
No.
Excessive hair growth?
My arms.
Your arms, okay. Don't worry, that's easily fixable. You can wax that, shave it if you choose. If not, totally normal, okay? We all have hair. Okay, and then I just want to look at your nails really quick. Okay, I'm just going to check your capillary refills while I'm looking at it, okay? So all of your capillary refills in your upper extremities were less than 2 seconds, so they were brisk. That's good. That means that you have great circulation to your fingers. Okay. I'm just going to go ahead and check the capillary refills. Can I remove your sock? Is that okay? I'm going to go ahead and check your capillary reflexes of your feet. Look at your toes. If you'll just bend your legs for me. Great. So your capillary refills on your toes were less than 2 and brisk. and it looks like you have great circulation to your feet. Okay, let me just check your dorsal pedis while I'm down here. Very strong, equal, +2. And popliteal, strong and equal, +2. Behind your tibial, posterior tibial, strong and equal, bilateral. Your extremities, they were warm, but there was no tenderness. It wasn't too extreme. It was just normal body temperature. There was no edema anywhere noted. Let me check your skin turgor. Good. Okay, skin turgor, all on extremities were good. So it looks like you're fairly hydrated. You drink a lot of water?
Yes.
Good, okay. So for your upper body, the alignment of your head and neck, it looks normal. I don't see any issues there. I'm just gonna have you come scoot forward. I'm just gonna look at the alignment of your back. I'm gonna take a look at your spine. Okay, it doesn't look like there's any lordosis, kyphosis, free of scoliosis. Your spine looks nice and straight and intact and curved the way that it should be. And you were able to move all your head and extremities. Your joints, the color was right for ethnicity, and you were able to move all of your joints without any issues or abnormalities. They're free from edema, masses, or deformities. I'm gonna perform a muscle strength test. I'm just gonna have you grab my hands, squeeze, perfect. And now I'm gonna have you push against me, and now pull. Perfect. And I'm going to have you do the same if you'll just stay back. I'm going to have you pull your feet up. Good. Now push down like a pedal. Good. And then can you lift your legs up and hold it? Good. Without letting it drop. Perfect. Okay. Let's see. All right. And then both of your arms. Okay. Looks good. All right. So muscle strength 5s all around. Able to move all extremities bilaterally equally. They were all symmetrical, okay? So I would give you some 5s all around. So now I'm just gonna look at your peripheral vascular. I'm gonna palpate your carotid arteries and then take a listen to them. I'm gonna do them one at a time. I don't want to do them both at the same time because if I did, you would lose circulation to your brain, and I don't want you passing out on me, okay? Mm-hmm. Okay, they were both strong and equal. All right, free of your carotid arteries were free of bruit or thrills. I'm gonna look at, and I already looked at your brachial and radial pulses, and I checked your popliteal, tibial, doralis pedis, and all of your capillaries. So your peripheral vascular system is intact. And I'm gonna look at your chest to see if there's any pulsations, masses, or heaves. And there's none that I can feel or visually see. So those look, your precordium is free of any presence of masses, pulsation, or heaves, and for palpation, free of any masses or tenderness, thrills, or pulsations. Now I'm gonna take a listen to your heart sounds, okay? So I'm gonna listen to your aortic, which is in the right intercostal space, your pulmonic, which is in your left second, your second pulmonic or your Erb's point, and then your tricuspid, and then lastly your mitral and apex, and then I'll be listening to your apical pulse for 1 minute, okay? So let's begin. Do you mind if I get under your shirt here? It's okay. Okay. Erb's point. Listen to your apex. Okay, now I'm gonna go ahead and listen. So I listened to your aortic, pulmonic, second pulmonic, your tricuspid, and your mitral. And I'm gonna listen to your apical pulse for 1 minute. And I'm gonna use the bell of my stethoscope just to make sure I'm here, or the diaphragm of my stethoscope, and then I'll go back and listen with my bell to hear for any murmurs.
Okay.
So I got a 62. Is that kind of correlates with your pulse? Does that sound normal for you?
Yes.
Okay, perfect. And then I'm just gonna verbalize that I would assess for murmurs in each of the 5 cardiac areas using the bell, which is the smaller side of my stethoscope. And I would have you sitting, lying, and then left laying. The reason that we would lay you on your left side or side laying is just to be able to hear the murmurs better. Okay.
Okay.
All right. And now, when was your last bowel movement?
This morning?
Okay, good. And you don't have any issues in your stomach?
No.
All right. I'm gonna go ahead and listen to your gas exchange. And you look like you're not having any labored breathing. Your respiratory rate was great. It was 17 from when I first took your vitals. And the rate and rhythm was equal and bilateral. Your intercostal, you weren't using any accessory muscles. You weren't nasal flaring or pursed lip breathing or anything. Your thorax was symmetrical and the skin integrity was good and free of heaves. And I palpated your chest, your precordium for any masses or tenderness. And again, you had that symmetrical chest expansion. I'm going to check your tactile for mitis, okay? So I'm just going to want you to say 99.
99.
Again?
99.
Good. And then just sit up.
99. 99. 99.
Okay, perfect. And I'm going to go ahead and listen to your lungs and all of your lobes. I'm going to first start anteriorly and then I'll go posterior and lateral, okay? And just breathe normally for me, okay?
Mm-hmm.
All right, if you'll just sit forward to me so I can listen to your posterior lung sounds in your back. And here I'll ask you to take deep breaths, okay? Okay, all lobes anterior and posteriorly clear. And free of any abnormal sounds. I didn't hear anything abnormal in your bronchovesicular, vesicular, presence of any adventitious sounds. So your breathing looks good, your lungs sound good, okay?
Okay.
All right, so now I'm gonna have you bend your knees just to relax your abdominal muscles, and I'm gonna lay you down a bit so I can inspect, palpate, and listen to your abdomen, okay?
Okay.
So first I'm just gonna inspect it. And then I'll auscultate it, and then I'll palpate it. The reason we do it in that order is because I don't want to mess up any of your bowel sounds before I listen to it, okay? Okay. So it looks like it's free of any masses or lesions, so that's good. And then I'm going to go ahead and take a listen to it. And I'm going to start with the right lower quadrant and then work my way up to the right upper quadrant, left upper quadrant, and lower left quadrant. All bowel sounds were immediate and normal active. I was able to hear in all 4 quadrants. So now I'm going to go ahead and palpate in that same order, okay? I'm going to start with the light palpation. Any pain?
No.
Okay. I'm going to do a deep palpation now. Any pain?
No.
Okay. So your abdomen was nice, soft, and tender, nice and flat, free of any masses that I could feel or any lesions, and it was no tenderness or pain while I was doing it. I'm going to go ahead and check for the... deep palpation would be necessary if it would require 5 to 8 centimeters of depth, but you said it was free of any tenderness or anything. All right, and now I'm going to go ahead and check your kidneys. So I'm going to have you sit up, and I'm going to do what is called a costovertebral angle tenderness bilaterally, okay?
Okay.
just lean forward. Oh, that way is perfect. Okay, you let me know if you feel any pain, okay?
No. No.
All right, perfect. You go ahead and sit back. All right. So it looks like we're all done here. I'm just gonna go ahead and clean my equipment with alcohol. And do you have any questions, comments, concerns, anything that you want to tell me about?
No.
Okay. So I'll just see you in your next follow-up visit. We usually do physical exams once a year. Okay.
Okay.
I'm gonna just put your bed down for safety. Finish cleaning my equipment. Okay, that's the lowest setting. And I'm gonna discard my gloves. I'll put this curtain so you may leave. And do you need anything before I go? All right, so I'm gonna go ahead and throw these out and clean my hands. And I believe that concludes our assessment today. Okay?
Thank you.